Yeah. So tell us a little bit about what kind of doctor are you? What do you do? How does it relate to autism? Tell us about med maps. Tell us the whole story.
Sure. Well, no, I always love the question, what kind of doctor are you? Because my answer is always a really good one. No, I went to medical school in 1981 to 1985, University of Michigan, general surgery residency. I did not see a single kid with autism. And again, in 1981, I think the autism rate was 1 in 10,000. So why would I see somebody, right? It used to be integrative treatment of these neurodevelopmental disorders. Now it's just any chronic pediatric condition is what we're talking about. So we're talking seizures and asthma and, inflammatory bowel disorders and all the gut stuff and eczema and, all the chronic illnesses you see with kids. Even, my kid gets an ear infection every other month. Well, that would be a reason to see a MAPS practitioner because we understand why they're getting it. And, we like to say they're not getting an ear infection because of an acute lack of amoxicillin or something, right? There's another cause of it.
Right.
None of these diseases are caused by the lack of a drug. There's a biochemical reason for it. And if you can understand that and treat that, you can move forward. Why isn't everybody running around at the CDC and the NIH with their hair on fire trying to figure out what's going on? And they're just not. Their answer to the autism epidemic is we're better at diagnosing it. Really?
Mm.
28,000% increase in autism since I went to medical school. And it's all because we're better at diagnosing it. And then I'm 64. Where's all the 64-year-olds with autism? Because I don't know any.
What, in your opinion, is causing the epidemic of autism? That's a loaded question.
Did I?
And be careful you don't use the V word.
No, did you? I didn't think we booked 6 hours for this discussion. Look, and we have some clues. There's no 100%, but the issue is that we've got at least 65 to 70% of kids on the spectrum have evidence of brain inflammation. All right. And it's not just brain inflammation, it's autoimmune brain inflammation. And this is based on an autopsy study where they looked at brains and they said, yeah, there's actually damage to the brain from this inflammation. And the cells that are in there are not from infection, like, West Nile virus or something. The cells that are in there are autoimmune type cells. So this is an autoimmune encephalitis, 65 to 70% of the time. So back to the question, what causes autism? My answer is toxicity. All right. It's all about the toxicity of the food, the toxicity of the environment. And the trouble with kids, you're also talking about, toxins that are look at baby formula. Try to read a baby formula label and tell me you can pronounce 90% of what's in there. Right. And then we've got the issue of injections. We've got the issues of medications. Again, if your answer to every symptom is a pharmaceutical, and I'm not bashing drugs, I think they can be very life-saving, but if you're going to put a kid on a pharmaceutical for a long period of time, that pharmaceutical is going to have toxicity associated with it. They all do. It wasn't like that when I was in medical school, right? Toxic foods, probably know the autism diet. Yeah. So what's the autism diet? It's going to be like grilled cheese and Cheez-Its and, fruit roll-ups and
chicken nuggets and French fries.
Chicken nuggets from McDonald's. Okay.
Yeah.
So do the right plug here.
Right.
It's like garbage. It's garbage food that's addicting. And the problem is it's like your kids are on heroin, and as long as they're eating this stuff, they're just making their autism worse. Right. And so for me, the biggest thing we can help parents and help kids with is how do you detoxify that kid?